Our final presenter is Ulrika Akenine, who is a research nurse at the Memory Clinic in Geriatrics Department at the Karolinska University Hospital in Stockholm. She's going to talk to us about positive features of enrolling people from a different part of the world.
Thank you. Yes, I would like to tell you why people with Alzheimer's disease would like to participate in clinical trials, and the relatives, who is a very important part, as we heard Goldie just told us. So the goal for this study is to find out the motives for the patients and the relatives to participate in clinical trials, and what expectations do they have on their participations. Well, as research increases, the demands on that we put on the patient to be in these studies increases as well. So let's just have a quick look what an average vaccination trial may look like if you were a patient. What do we ask for the patients to be a part in? Well, they have to visit the clinic for maybe 30 times. They have to do MRIs 6 times, PET scans 2 to 3 times, draw blood 40 to 70 times, ECGs 10 times, 2 to 3 lumbar punctures, cognitive testing 8 times, and dosing at the clinic where they maybe have to stay overnight. So this is what an average vaccination trial looks like. And we ask the patients to do this in a period 12 to 18 months. So that's a lot, isn't it? In this study, we used a questionnaire with open-ended and structured questions. We have 19 patients and 20 relatives, all recently included in one of 5, I think, ongoing vaccination trials at Karolinska University Hospital. The patient had all mild to moderate AD, mean MMSE 23 points, equally share men and women, and then a mean age of 66 years. So this is quite young and quite well-functioned patients. So what's the result? Well, they want to help the research, contributing to research. This is an outstanding, most important thing for these patients. And of course, there's a hope of easing of symptoms or even cure. And what about expectations? Expected advantages of study participation is access to medical expertise. The patient and the relatives, they want to see doctors, nurses, psychologists, and so on that are experts in Alzheimer's disease. Regular health checkups, that's an important thing. And information. They want information about their disease, about research findings. They want information of resources in the community. This is very important. And expected disadvantages. Risk of side effect and harms. Risk of receiving placebo. This is a great risk for this patient. They don't like this about the placebo. Pain and discomfort. Of course, there's a lot of blood drawn and lumbar punctures and so on. And it's time consuming. So how can we benefit if we really we now know that this participation is, the motives for participation is they want to contribute to research. Well, if we understand the motives, it will make it easier to recruit. Understanding the expectation increase quality, the quality of collected data, and the quality for the patients in the study. And better quality for the patients decreases dropouts. And of course, this is expensive trials, this vaccination and these complex trials. And I think this knowledge is very important in many parts of the study process, when designing new studies, in recruiting, as Goldie told us, and in every meeting with the patient and their relatives. Thank you.